This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark Neuse.
Good morning, and welcome to another edition of Columbus Concerns. I'm Mark Neuse. Thanks so much for joining us this morning. Our guest on the program today is McKayla Elliott. She is the State Opioid Response Program Manager for ADAM-H, or the Alcohol, Drug, and Mental Health Board of Franklin County. And McKayla, thanks so much for stopping by today.
Thanks for having me on, Mark.
Well, I tell you, one of the things we would like to talk about this morning is that Ohio State has partnered with ADAM-H to do something to try to save lives in the campus area. Tell us about that.
Yeah, so we're really excited. The ADAM-H Board of Franklin County is partnering with the Ohio State University and Wexner Center to place 28 Nalox boxes across the university campuses and Wexner medical centers.
So tell us about what a NaloxBox is.
Yes. So an NaloxBox is a box kind of like an AED. If someone were having their heart stopped beating, you would use an AED defibrillator to bring them back. An NaloxBox contains naloxone, which is an opioid reversal medication if someone's having an overdose. This is life-saving medication. So the box contains the medicine and that. So we're putting it across the campuses to try to increase access to save lives.
And this is really nothing new. There are Nalox boxes all around Franklin County, right?
Yeah, we actually have 167 Nalox boxes placed across Franklin County in places like the libraries, the rec centers, CHN and their apartment centers, and St. Stephen's Community House as well.
You know, it's interesting. I was looking at the numbers from the Franklin County Coroner's Office. 2021, 825 overdose deaths in Franklin County. In 2022, that was at 790. This is a big problem. So tell me about how much of that, how many of those deaths do you think were caused by opioid addiction?
So in 2022, we know that over around 89% were caused by an opioid overdose.
Wow. And
of that, of those opioid overdose, 85% were caused by a fentanyl inside of the medication as well. So
is the naloxone, does it work for fentanyl as well as the regular opioids? Or?
Yeah, that's a great question. So naloxone will work on any opioid medication. So it could be in the opioid family. That's things like prescription painkillers like OxyContin, Vicodin, fentanyl as well, and also illicit drugs like heroin. So it will work on anything in the opioid drug family. It will not work on something outside of an opioid.
You know, it's interesting because I imagine that if someone has overdosed and they need help, whoever's with them is going to know what happened. But if I'm just walking down the street and see someone in distress, how do I know that they're suffering? What are some of the symptoms that I should look for?
Yeah, that's a great question. So someone experiencing an opiate overdose death will usually have very shallow breathing, or they might not be breathing at all. They'll be unresponsive. So if you go to rub their sternum or you try to talk to them, they're not going to respond to you. They'll also have really pinpoint tight pupils, and they might, if it's been a while, they might have a bluish tint to their skin as well.
And if you're in doubt, what do you do?
In doubt, always call 911 and always, ask the person first, try to wake them up. If they're not waking up, it's totally fine to administer naloxone. Naloxone is a very safe medication. It won't hurt the person. If they don't have an opioid overdose, it will still, it won't hurt them. So always important. If in doubt, use it.
Do you have any numbers on how often these Nalox boxes are being used?
Yeah, so we know that since the program started in 2021, it's been used to save over 10 lives so far.
Oh, that's great.
Yeah.
And what are you doing at Ohio State to make people aware of where they're located?
Great question. So on our ADAM-H website, we have a locator for all of our boxes across Franklin County, and OSU also has a NaloxBox page where you can find their 28 locations across their campuses as well. And
do you also have a list of where they can be found around the rest of Franklin County?
Yes. On the ADAM-H website, you can go to adamhfranklin.org, and if you search Nalox boxes, we have a map locator for the other 167 boxes.
So again, the website is
adamhfranklin.org.
And Adam is spelled ADAMH.
Yes.
Okay. We're talking today with McKayla Elliott. She is the State Opioid Response Program Manager for ADAMH, which is the Alcohol, Drug, and Mental Health Board of Franklin County. And we're so glad she joined us today to tell us more about naloxone and what it does and how it helps save lives and how they're partnering with Ohio State to put their NaloxBoxes on campus and at the Wexner Medical Health Center, expanding the emergency response tools on campus, something that they've done all over Franklin County, in fact. For those who aren't really familiar with ADAMH, tell us a little bit about the board and what it is you do.
Yeah, so the ADAMH Board of Franklin County, our job is to plan, fund, and evaluate mental health and addiction services for the residents of Franklin County. We do this in partnership with 30 nonprofit contracted behavioral health care providers to ensure that quality services are available in neighborhoods across the community.
And you're funded by the voters, right?
Yes, we are funded by the voters. About 70% of our current 2022 budget comes from levy dollars that are approved by Franklin County voters.
Now, I also know that you really help people when it comes to paying for the services that they need. When it comes to setting up a sliding scale and things like that.
Yes. At the Franklin County Board of ADAMH, we believe that everyone should have access to mental health services, recovery support services, treatment services, anything that they need. We believe that regardless of their income, age, geographic location, that they should have access to the care that they need.
So when it comes to access of care, how do people go about doing that?
Well, through our 30 providers, we have access to care across Franklin County. We also now have a phone number called 988 where people can reach out if they're having a mental health crisis or any kind of substance use disorder crisis as well. You can call 988 and get in touch with experienced professionals. And
I just from what I've heard, I understand the 988 has become very effective.
Yes, it's been very effective in Franklin County. I think it rolled out in about a year ago, 2022-ish, and so it's been very effective so far in Franklin County.
Very good. McKayla Elliott is our guest today, the SOR, or State Opioid Response Program Manager for ADAMH. Just to get some of the verbiage out of the way, sometimes I hear people refer to the antidote as naloxone. Sometimes I hear the word Narcan. Is there a difference?
Yeah, we get that a lot, and whatever you say is totally fine. Naloxone is just the generic form of the drug, and Narcan is one of the name brands for the drug, but you can use them interchangeably. A lot of people do, and it means the same thing. Yeah.
Now, being the State Opioid Response Program Manager, tell me a little bit about the way that ADAMH and the state of Ohio work together.
Yeah, so we work together on a lot of different projects. Through my job, we work through state opioid response dollars that Ohio MOS receives from SAMHSA, and we use those dollars throughout the community to help people through providing access to recovery housing, medicated-assisted treatment, recovery support services, and also outreach throughout the community as well.
Is there also a federal part of this, or is it just mostly from the state?
So the dollars come from the federal government, and then they pass down into Ohio MOS at the state level, and then they distribute those throughout the counties in Franklin County. So many counties across the state will receive these dollars as well.
It's not a huge decline, but we talked about the numbers of overdose deaths in Franklin County, 825 in 2022. We're in 2021. Then in 2022, it went down a little bit to 790. Do you think that's going to be the trend? Are we starting to see lowering numbers when it comes to overdoses?
We're hopeful that with increased access to naloxone, we will see that, and also more access to care to treatment for people experiencing opioid use disorders. However, there's still a lot of work to be done. The numbers in Franklin County right now in 2022, it was 753 overdose deaths, and that's a 38% increase from 2019 before the pandemic. So there's still a lot of work to be done.
And the naloxone seems to be very highly effective, right?
Yes, it is an amazing medication. It's super safe to use. Even if someone wasn't experiencing an opioid dose overdeath and you didn't know, you could still use the medication and they would be fine. And the naloxone that we use in the naloxone boxes is a nasal spray that you can use. Each naloxone medication box will have 2 doses inside of it. It's very easy to use. You would just put it up the person's nose and spray and wait a couple of minutes to see if that person responded to it. While you're waiting, you can put them in the recovery position and make sure that they're okay. Sometimes they might aspirate or vomit, so important to have them in that recovery position. But if the person does not respond within a couple of minutes and the EMS still hasn't arrived, there's another dose, so you can put it in the other nostril. You would just put it up their nostril. You don't need to, a lot of people think that you have to prime the medication. It's like a nasal spray, like you'd give someone Flonase. So they think that you might have to push it before you can use it. If you push it, it will immediately use. You don't have to prime it. You can just push it in and the spray will come out in the nose.
And I guess there are instructions on the boxes?
Yes, there are instructions inside the boxes, and each of our Nalox boxes also has a QR code on the top of it. When you are looking at the front of the Nalox box, you can scan that and a 30-second video will pop up that visually displays how to administer naloxone as well.
So when it comes to the boxes at Ohio State, how did you choose the locations?
So that was a big partnership with OSU deciding on which places got the most foot traffic. So we have them in places like dorms, at the medical centers, like right when you're coming out of the parking garages. So places that a lot of foot traffic is going to receive. So that was a big partnership with OSU.
Signage, I imagine, to show where they are.
Yes.
It's my understanding, just from reading some of the website, you can also get a personal supply of naloxone if you need it. Is that correct?
Yeah. If you go to our website, adamhfranklin.org, there is an opportunity for you to reach out to Project Dawn or the Columbus Public Health Department to receive your own personal package of naloxone.
And I imagine if you're a parent or and you're a little bit worried about somebody, that they have a problem, you can just call and get your own supply.
Yes, it's very important. I think everyone should carry naloxone. It is an amazing life-saving drug, and unfortunately, you could come across it anywhere, whether it's your job.
Again, our guest on the program today is McKayla Elliott, the State Opioid Response Program Manager for ADAM-H, the Alcohol, Drug, and Mental Health Board of Franklin County. Again, give us the website if anybody has questions about what we're talking about today.
Of course. So the website is www.adamhfranklin, that's ADAMH, franklin.org.
And I imagine that there are instructions on there and all kinds of interesting facts about the naloxone and how you can use it and where you can get it.
Definitely. If you just search NaloxBox on the website, a page will pop up that has information about the boxes, naloxone in general, where to find the boxes, and also how to get your own personal supply of naloxone.
And it's my understanding that most first responders carry naloxone now?
Yes. It's become standard to carry it just because of how intense the opioid overdose epidemic is in Franklin County.
I have heard about a sort of fatigue that the first responders get because they're seeing the same people over and over again in many cases, and that it's very difficult for them to deal with this on a day-to-day basis. Is that still the case?
Yes, I think across the board in the medical profession, I think we're seeing a lot of burnout, especially since the pandemic. People are, it's really been really tough on the workforce.
And does ADAM-H offer any prevention programs when it comes to drug addiction?
Prevention programs for drug addiction?
Yeah.
Yes. So we do a lot of outreach throughout the community, notifying people and educating people about naloxone, about the opioid overdose epidemic that we're experiencing, because a lot of people just don't know, or they think that it's not happening in their neighborhood, and it definitely is, unfortunately. It does not discriminate. So we do outreach programs, and we also have prevention programs that we do in the schools and throughout the community as well, through our provider network.
We've been talking today with McKayla Elliott, the State Opioid Response Program Manager for ADAM-H. As we wrap up here, give us an indication again of just what's happening on the Ohio State campus and how you're partnering with the university.
Yeah, so the ADAM-H Board of Franklin County, in partnership with the Ohio State University Wexner Center, the Ohio State University and the Ohio State Wexner Center. We have placed 28 Nalox boxes across their campuses and medical centers to increase access to the community for naloxone, a life-saving opioid overdose reversal medication.
And these are in how many locations again?
There are 28 locations across Ohio State's university and medical centers, and then we have 167 locations across Franklin County.
And more information, of course, on the website, which is
www.adamhfranklin.org. That's Adam H, ADAMH, Franklin.org. You can just go to the website and search Nalox boxes, and everything will pop up for you.
Well, very good. Well, McKayla, thanks so much for being here today. We really appreciate it, and good luck with the program.
Thank you so much, Mark.
Also on this morning's program, we're going to take a look at another big problem here in Ohio, and that is problem gambling. With us is Scott Anderson. He is the problem gambling coordinator. He is with the Ohio Department of Mental Health and Addiction Services. And this is Problem Gambling Awareness Month. And Scott, thanks for stopping by. We appreciate it.
Oh, thanks for having me. This is a really great opportunity.
Tell me a little bit about the goals for Problem Gambling Awareness Month.
Problem Gambling Awareness Month is just to bring to light, try to mitigate some of the harms that can be associated with gambling. We know that a lot of people gamble. A lot of people gamble for recreation, for fun, for enjoyment. But there are a select few people, about 1% of Ohioans, that actually have a gambling disorder, and close to 11% of people that are at risk for having some problems associated with their gambling.
And of course, you know, gambling has become legal in many ways in Ohio over the last several years with the onset of the casinos. It's been quite a few years now, but I guess time creeps up on me. It seems like only yesterday. And the racinos and the expansion of gambling. And now we've got sports gambling coming up next year. So tell me a little bit about how things have changed in the state since gambling became legal.
We were one of the few states, in fact, the only state for a while, that had prevalence data prior to anything opening. So we knew in 2012 approximately what the concern was. And it was around 5% of Ohioans that had either a ongoing or a upcoming problem with gambling. 5 years later, in 2017, we repeated the survey, and all of those numbers doubled. It went from 5% up to 10 point something, so it doubled in that short time. And we anticipate with sports betting, that's going to introduce another entire group of gamblers or a different type of gambler to that mix. So we anticipate that again rising with sports betting coming online. So we went from having the lottery and horse racing and bingo and things like that in Ohio to having 11 brick and mortar locations, 7 of the racetracks with video lottery terminals, and 4 casinos with table games, slot machines, and full service in an 18-month period, which was unprecedented. Mm-hmm. So we really had an expansion, and we're looking for that same type of expansion now with sports betting coming online.
And it's interesting because with sports betting, unlike the table games, you don't have to go to a casino. You're going to be able to do it right on your phone.
And that's going to be a real concern. If you think about how we use our phones now for everything. So if you have a problem with anything, shopping, gaming, anything, it's in your pocket all the time or on, at the end of your arm. So gambling with sports betting apps is going to be a huge concern because it's going to be on credit cards. You're going to put credit in there, start an account, and then you're going to be able to bet balls, strikes, first downs, pass, kick, punt, by quarter, by half, by whatever the color of Gatorade dumped on the coach at the end of the game. And you're going to be able to just use your thumb to bet, continuously through an event.
Scott Anderson is our guest today, problem gambling coordinator with the Ohio Department of Mental Health and Addiction Services. Now, there is a group called Ohioans for Responsible Gambling, but that is several state agencies put together, right?
And back when this started, the Ohio Lottery and at that time the Ohio Department of Alcohol and Drug Addiction Services, ODADIS, had a partnership where the lottery had been giving funding for treatment and training and things like that. When the casinos came online, we realized it was going to be a much more of an issue, and the Casino Control Commission was created to regulate the casinos. So the lottery, Ohio Department of Mental Health and Addiction Services, the casinos, and the Racing Commission all got together and said, let's not step on each other's toes, areas, duplicate our efforts. Let's figure out what each of us do it together, and do it well. And we've been very, very successful at that. In fact, we've been noted nationally as the Ohio model, how to do things. We created a credential for people to treat gambling. So it's just not anybody. You have to go through a process to say you're competent in treating gambling. We have a helpline that's 24 hours a day. We've very recently added a warm transfer to that helpline. So anytime you call, you can be connected directly with a trained clinician to talk to you about what's going to happen next, what your resources are, how to go forward with that. There's a website, beforeyoubet.org, beforeyoubet.org. There's resources available there for tips on responsible play, warning signs if you're getting carried away. And also there's a 9-question test that you can take on there to assess your current risk. And that's great for you, a loved one, or someone you're concerned about.
And now that sports gambling becomes legal next year, how much thought has been going into how to control that?
We're watching very closely every other state that has gone before us. Unfortunately, with gambling, and this goes back all the way to the lotteries, every state is going about it in a different way.
Yeah.
Each state has created their own legislation, their own funding stream, their own way to treat, their own way to mitigate harm. So we're very, very closely watching all the states that have gone before us and trying not to do anything that has not worked in other areas and learn from those mistakes. But Casino Control, Lottery, and us are in constant communication about the rules, how it's going to be pushed out, where the warning, if we can get our helpline number incorporated, if there's going to be limits on spending, on credit, on length of play, velocity of play, and so forth. And also we're very worried about age verification.
Mm-hmm. Yeah, definitely, especially just on your cell phone.
Right.
Talk a little bit about what does responsible gambling look like?
Very simply, if gambling causes a problem, it's a problem. So don't think about $100 or $10,000 or $1 million or $5. If it causes a problem, it's a problem. Now, what we always recommend is set limits on time and money. So if I'm going to set aside $20 for my entertainment today, and I'm going to buy $20 worth of lottery tickets or go to the casino and play the slot machine with my $20, when it's gone, it's gone. Don't go to the ATM, try to get more, try to get back. And also, if I'm going to gamble, set a time limit. It's real easy for time to get away from you in those events. So I'm going to be here an hour, and then we're going to eat. So no matter where I am at the end of that hour, up, down, or in the middle, that was my hour, and now I'm going to go grab a hot dog or a steak and be on my way.
And there are risks with gambling. That's why they call it gambling. You have to know those risks.
And gambling is a very unique, mood-altering experience in that it has an element of hope.
Yeah.
I could win. The next card, the next pull, the next game, the next whatever, I could win. You're not going to see somebody that does anything else think, if I just do this a little longer, my rent will be paid. If I just drink more, my child support will be caught up. It doesn't have that element in anything else. So there's a real solid element of hope, and that you can't see it. I could have lost money on my way in here on my phone. You wouldn't be able to see it. I mean, I don't have lottery breath or, anything like that. So you can't see it until it's really, really too late.
Well, talk about the common warning signs. For maybe you're looking at a loved one, a child, a spouse. What are some of the common warning signs that gambling has gotten to be a problem?
One would be lying, being dishonest about how much I've won, how much I've lost, where I've been, being unable to account for time, unable to account for sudden windfall or selling items or things missing that televisions, stereos, cars, houses, jewelry, anything like that. But dishonesty is a huge warning sign. If someone can't account for their time, money, either plus or minus, and whereabouts, that's a huge warning sign. And I always use this analogy. I love corn on the cob. It's one of my favorite things in the summertime, but I don't have to control my use of it.
Yeah.
I don't have to. I've never tried to sneak it into the movies. I've never eaten it in the car. So if you're doing something that has an element of secrecy or it's not the way it's normally used, that's a huge warning sign too.
We're talking today with Scott Anderson. He is the problem gambling coordinator with the Ohio Department of Mental Health and Addiction Services. And this is Problem Gambling Awareness Month in Ohio. And Scott, talk a little bit about what responsibilities the casinos, the racinos, and other gambling operations in Ohio have. What is their responsibility to try to cut down on irresponsible gambling?
Every property, every physical property has a person in compliance that's responsible for their response. Caesars has a problem gambling ambassador training. Penn Gaming has a very, very robust employee training. All of them really do. And they're trained to see people on the floor. Maybe they've been there too long. They're not taking bathroom breaks. They're not eating. Their hygiene is starting to slow. They're banging on a machine, making statements that would be alarming, like, oh, there goes my rent, or I can't go home, or, my husband's going to hate me or something. So they're trained to listen to those things, and they do intervene with a trained person on the floor. Now, those folks also, they have to have our written materials and our helpline posted everywhere money transacts. So it's on the ATMs, it's at the cages, it's anywhere money is changing hands. Our helpline, which is 1-800-589-9966, is available for someone that finds themselves in a crisis or in need of someone to talk to. But the casinos, we just had a conference where we had many of the gaming people represented. We have really good relationships with them through the Problem Gambling Network of Ohio, where we do property tours and we take clinicians into the casinos and racinos to meet the people that they would be dealing with directly and to see, what their response is. So we have a real good relationship with the lottery, the casinos, and the racetracks.
In your profession, and you are a trained clinician, correct?
I am.
What damages have you seen from gambling problems?
The biggest one is relationships. So if I lost my wallet and I lost $100, I could tell my wife I dropped my wallet and lost $100. But then if my wife finds out that I was at the casino and I spent $100 at the slot machine, now I've lied. Mm-hmm. So you can get money back, but you can't get trust back. So the relationships is the biggest one. And like I said, it goes on. I'm not going to overdose. I'm not going to pass out. I'm not going to get sick. I might have sleep deprivation if I continue too long, but it's really invisible. And now I'm in 30,000, 40,000, 50,000. Well, how do I get out of that? Go get a part-time job, or do I gamble?
Yeah. So
the problem and the solution sort of change places in my head, where the only way I'm going to get out of this is to continue doing it. So that's a huge thing that we see. And the other thing is, anybody that has access, we've seen people embezzle money from employers, churches, civic groups, youth organizations, and they'll say, I'm not stealing it, I'm just using it because I need ammunition to get back to where I was.
Yeah.
So people get into legal situations pretty rapidly too.
Talk about, you talked about the helpline. The number again?
1-800-589-9966.
And what other resources are available here in Ohio to help people who think they may have a gambling problem?
We have the Problem Gambling Network of Ohio, which is a great organization. That's pgnohio.org. We have our websites, which is beforeyoubet.org or changethegameohio.org. So you can get information on gaming, gambling, and some advocacy and resources from all three of those sites.
Thanks so much for joining us today on Columbus Concerns. I'm Mark Noose. See you again next week.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.
Food. Our survival relies on it. Yet every day in central Ohio, nearly 1 million pounds of it enters the landfill. When we choose to throw food away, we're choosing to discard all the resources that were invested along the way, not to mention the money that's being tossed out. But together, we can make choices that make a difference in our community and protect our environment. Learn more at safemorethanfood.org, a program of SWACO.